Okay, good morning, everybody. So welcome to the last day of what was Global Summit. And as it's the last day, we're having the closing plenary later on this morning for me in 2.5 hour time, wherever you are. And that will include some closing remarks, but also include the prizes. So that includes both the GGN awards that have been announced during the course of the conference, but also the conference prizes. So we have a prize for best poster, we have a prize for the most retweeted tweet and most prolific tweeter. We have voting for the best poster, best presenter, and best panel. And we have also a prize for the best presenter from a developing country. So you can vote. I put the voting form in the chat earlier on when I was first got online. I'll repost it in the chat. Check your email. There's an email with the link to the voting form. Please do everyone make sure you go and vote for the best presenter and so on. And please do come to the closing ceremony where we'll give out the awards. So there are 5 presenters in the program. We're down to 4 who are presenting this morning. We're down to 1 who's actually made it into the session, which is Reimeingam from the Institute for Social and Economic Change in Bangalore. And so Reimeingam, I'm going to hand over to you in a moment. Reimeingam Marchang, hand over to you in a minute. Please introduce yourself a bit more. I'd say take as long as you want presenting, because I think we can have at most 2 presenters, and we'll see how it goes. So Reimeingam, over to you, please, and please share your PowerPoint and start.
Okay, thank you.
That's not the PowerPoint share, that's the mirroring your screen share.
One second, yeah, sorry. Yeah.
Same thing. So you have to go to the share, then to window, and then identify the PowerPoint.
Just a moment, sorry.
Yeah, no problem. Yep, that's it.
Is it coming full slide?
It's not full slide yet, though.
Okay.
And I'm glad to see Amany has joined us. Good morning, Amany. Good to see you. You're currently muted, you're speaking. So we're going with Reimeingam first, and then we'll come on to you next.
Is it a full slide?
Third presenter. Yes, Reimeingam, that's it.
Thank you.
We have a third presenter, Amany, who's joining, hopefully, but he's having problems getting in. So over to you, Reimeingam. So 15 minutes, I would say.
15 minutes. Okay, thank you so much.
15 is fine, yeah. Thank you.
Okay. Thank you so much for inviting me to make a presentation on this What's Works Global Summit 2021. My paper title is Impact on COVID-19 Pandemic on Reverse Migration and Labor Market in India. I'm going to see how migration, what was the pattern of migrations particularly pre-COVID-19 in India, and the situations during the COVID period, particularly in the first wave of COVID pandemic in India. So in India, what we have noticed was earlier that evidence shows that the empirical evidence shows that migration was increasing during the pre-COVID pandemic era period, particularly to the mega cities, particularly the big cities. But they do migrate, particularly because of the growth in the employment and also for higher educations, which are located particularly in the cities, in the big cities. During the COVID situations, we all know that there was a government lockdown, forced lockdown, and economic restrictions, closures of establishments because of in order to curb the COVID pandemic spread in the country. So eventually, many migrant workers tend to return back to their native or the origin of migrations, particularly for securing their livelihoods. Earlier, what we saw in the literature was that because of the unemployment or the various push factors like the lack of educational infrastructure or unemployment situation or political instability or political tensions and and so on, pushes for out migration from various states of India. But what we notice in the pandemic period is that the livelihood insecurity, unemployment problems, and particularly the pandemic disaster has caused them to push for reverse migrations. And as we know that as we know, and from the literature as well as from empirical data shows that they migrated back to their origin of migrations, particularly to secure for their livelihood and not necessarily like in the earlier pre-COVID situations for securing or for getting a better opportunity or otherwise or other reasons. In India, what we have noticed what we have seen from the data is that the people were increasingly mobile, and that's with the figure of past 2 decades. What we notice is that rate of migrations was increasing. Rate of migrations was increasing from 31% to 37% from 2001 to 2011. And if we consider only the migrant workers, there were around 46 million migrant workers in India. That constituted around 3.8% of the entire population of India. But the main reasons for out migrations and attracting to the bigger cities or the other states, particularly the more developed states, are because of the higher waste prevalences in the urban areas or in the cities or in the relatively more developed states. For example, the tendency to migrate towards urban areas was increasing, and yes, it was visibly high. That significantly higher in the urban areas was mainly because of the prevalence of higher waste rate. If we compare with the rural waste rate, more urban waste, for example, for the urban daily regular workers, were earning more than 50% in comparison with the rural daily salaried workers, that is the waste workers. And if we see empirically, the evidence shows that three in every 4 migrants originated from rural areas in India. This has some major implications. Particularly for the reverse migrants who have returned back due to the various causes, particularly the pandemic has pushed them back to reverse migrations to their state of origins. And this has an implication that because of the nature of employment, particularly the predominant agriculture sector or informal employments in the rural areas, this has an implications that the reverse migrants who were then is working in the non-agricultural sector in the cities were expected to work in the informal sectors. And by seeing the pattern of migrations from the nature of the streams of migrations, we notice that urban to urban migration has significantly increased. This is basically primarily caused by the higher waste rate, particularly in the bigger cities and the well-developed cities in comparison with the relatively lesser developed cities or urban areas in other states. And people who have migrated for employment, it was not very significant. It was hovering around 10% in 2011, 2001, as well as in 2011. Yes, people do migrate for employment, but the extent of migration for employment is not very much in comparison with the other, migration for other reasons. And 2011 data shows that it is evident from the 2011 data that people, I mean, the out migrations. If we see the net migrations rate in India, then what we notice is particularly from the lesser developed states, like the eastern states like Bihar and the central states like UP has more net out migration rate. I mean, here relatively larger net out migration rate, and um, and states like the I mean, which has more per capita income, like the Maharashtra or the National Capital Territory, Delhi, the capital of India, and it has more net in migration rate. That means that the states like Maharashtra or the NCT of Delhi attracts more people from the other states, and people from like the lesser, much more backward states like Bihar and Uttar Pradesh has a very massive out migrations from their states. And yeah, if we compare the, if we see the reverse migrations, so during the peak of the pandemic, first wave of the pandemic, as per the June 2020 data shows that across the states of India, the 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 extent of extent of reverse migrants who has gone back from their states, where where as much were much bigger for those states which were having lesser economic, I mean, lesser in terms of the economic development, like Bihar and Uttar Pradesh, which has higher out migration. But it is not necessary that all with a bigger it is not necessary that big populations like large population states like Madhya Pradesh, Maharashtra, Rajasthan, and even West Bengal or Gujarat not necessarily have a very proportionate reverse migrations. I mean, in other words, the rate of reverse migration is not very proportionate in comparison with the size of the populations. And if we see the rate of migrations, the reverse migrants workers in proportion to the populations of respective states and union territories of India, what we see is that of smaller states and the union territories like Chandigarh, Daman and Diu, Goa, and Sikkim, the smaller states in terms of population, in terms of geographical area, they have more, I mean, the rate of reverse migration was more. That also indicates that their populations, because of the lesser population size and the extent of migration in terms of out migration, in terms of absolute number, was relatively bigger. So what we notice is the bigger states does not have those states which have a larger out migration rate doesn't necessarily have the larger reverse migration rate. Perhaps this has to do with the attitudes, with the security, I mean, livelihood security, availability, and employment security in their respective state. If we see the how it has affected in the labor market, what we notice is that of course there was a change in the labor demand as well as the labor supply. The retrenchments and the closure of business establishments and all has restricted the absorption ability of the supply of employment. So, what we show, what the data evidence has shown is that there are many migrant workers were forced to take up the informal employment. Like, for example, the reverse migrants, in particular, were engaging in the farm activities. And yes, let me not go on to that, but the supply of labor during the COVID-19 pandemic situation was that whether there was an diminishing or increasing during labor supply during the pandemic, which we can notice is because through the reverse labor migration, job loss, livelihood security, as welfare, emotional also makes an important contributions in the extent of supply of labor. Data shows that what the labor force participation, I mean, particularly the labor force participation has contracted. If you see the peak of lockdown from March to April, it slipped to, extensively, considerably. And in opposite, in the labor supply, the unemployed, the number of people who are seeking for employment, the seeking extent, the unemployment rate has sharply increased. But gradually, by the end of June, July, it picked up. It picked up. The level of unemployment drop, as well as the labor force participation increases occur gradually. What we notice is that, of course, because of the lockdown, because of the pandemic, because of the reverse migrations, the nature and the extent and the magnitude of the labor participation rate has dropped, and the unemployment rate, particularly reverse migrants who, as well as who has lost their job, re-entering to the labor market, that makes the huge push in the unemployment rate. And also because of the retrenchments and the job closure, establishment closures, and all that, and the lockdown, and all the labor force participation drop significantly, particularly during the peak of the COVID pandemic. India has earlier even have experienced that India was growing we jobless growth, like the employment was shrinking from 2011 to 2018. If you see that it was growing at a negative rate, that means the employment was not growing at all in India. In terms of the number of employment,
2 more minutes, please, Reimeingam. Yeah.
Two more minutes, you say?
2 minutes, please.
Okay. In terms of employment, what we see is that the absolute employment number in terms of million, it has drastically dropped, particularly during the peak of the pandemic, and also during the peak of the lockdown in India. This shows that it is evident that the COVID pandemic has also a huge impact on the Indian labor market in terms of job loss, employment loss, and livelihood security, insecurity increases, and all. And India has, in terms of employment share, what we see past the data shows that in 2017-18 PLFS, that is periodic labor force survey, shows that regular salaried employment was only to 24%. That shows that many employments workers are working as a vulnerable employment sectors. India faced job loss of, particularly in terms of salary employment, from 2019-20 to 2020 August. During the pandemic, what we saw is around 21 million job salaried employment was lost. And the loss of job is particularly because of the high, significant share, because of significant share of the informal employment in India. 92% of the employment is informal sector, informal employment. And also the world data shows that, world data in comparison with the Indian data, that India's vulnerable employment is very high. It's above 70% in comparison with the world average, world level. This makes the extent of job loss, the nature of job loss, is because of the significant presence of the vulnerable employment. As I said in the earlier slide, that this is the impact of COVID-19, that the unemployment shot up. Yes, workers were laid off, and workers retrenchment, jobs lost, and re-entering into the new employment for new employment to secure the livelihood. That was very prominent during the pandemic period. And
you need to wrap up now, please, Reimeingam.
Yes. And if you see the monthly data, what we saw is that from the peak of lockdown and the peak of first wave of pandemic in India, the unemployment rate gradually subsided over a period of time across the states. And what we can learn from the COVID-19, based on the evidence, based on the data, empirical evidence, is that we need to formalize employment to secure more for securing job. To ensure job security and entering the job contract and agreement, and also to compensate job loss by constituting unemployment allowances and all. And lastly, it is very important to establish the job security, particularly for the migrant workers. With that, I end my presentation. Thank you all.
Okay, thank you very much. So we now have actually all four presenters are all here now. So we've suddenly gone from having a lot of time to lesser time. So next we have Vaqar Ahmed from the Sustainable Development Policy Institute in Pakistan. He's appearing as Yashika in her login, but it's Vaqar is there. So Vaqar, I hope you're set up to share your slides and start presenting, please, and introduce yourself any more than you wish to do so.
Thank you.
And 12 minutes if you can, please.
Agreed. I'll just make an effort to share, and please do confirm if you can see my slides.
Will do. I can see them. They're not, and that's perfect. Thank you. Go ahead.
Great. Can you see them?
Yes, I can see them full screen, everything, and moving.
Great. Thank you very much. Thank you very much. I'll be quick. This presentation actually revolves around our experience of working with the Ministry of Commerce in Pakistan, and amid the first and second rounds of pandemic, we engaged very closely with them, trying to help them with their evidence use needs and how production of rapid evidence could actually be put on their table as quickly as possible to allow them for quicker decision making. This presentation would actually talk about the last of the three things more, which is some of the lessons which we have gained from this work in our engagement with the government amid the pandemic. We, in fact, entered with three sets of objectives in this engagement. First was to increase the use of evidence directly by informing policy, because the policy and regulatory measures were changing fairly quickly. Second was to increase the use of evidence at system and process level within the ministry. And third was to remain actively engaged with these public servants as their demand or the way they were supposed to use the evidence was changing fairly quickly. Almost on a daily basis, there was a new set of evidence which was required to respond to, let's say, the needs in the lockdowns or the way SMEs, small and medium enterprises, could be facilitated. We started off by sort of providing a more in-depth analysis of evidence ecosystem in the trade policy space. We did understand that the pre-COVID trade policy had to change fairly quickly in order to allow for more evidence to pour in at a rapid pace and allow the ministry then to take decision based upon how various stakeholders were trying to sort of relay or trying to communicate their messages. Within the stakeholders mapping, we in fact focused, given the time and resource constraints, we in fact focused on key evidence producers and key evidence users and connecting them almost on a daily basis, what we called a public-private dialogue forum, PPDF, which we created within the ministry, and it remained there until the end of the second wave of the COVID. Interventions which were carried out first was a structured stakeholder dialogue, which was a public-private dialogue.
Okay, we appear to have lost our presenter, which is unfortunate. And it seems you can't see me, which is unfortunate too. So things are going pretty much as standard according to as per Hopin. I suggest we don't wait for Azar to reconnect, because that might take some minutes, and we're losing more people. And we move on to the next presenter. Nope, we seem to have lost everyone. Nope. Okay, Azar is back. We'll carry on with you. Please carry on where you were.
Sorry, I don't know what happened. Sorry.
Me neither. We lost the other presenters too. So please carry on.
Yes. Can you see the slide now?
Yes, it's fine again, and this is where we were. So,
Yeah, yeah. So the first intervention was, as I said, around the structured public-private dialogue. The ministry does have a tradition of having these dialogues twice every year, but of course, COVID prompted a more immediate need, and these PPDs were then structured to happen almost every week during the first wave. Second was to allow the ministry to do this on their own, and for this we ended up having a capacity development intervention for the ministry's own institute, so that even after COVID, they're able to have a structured public-private dialogue and put in place a calendar to do this on their own. And third, we also carried out a diagnostic of one of the arms of the ministry, and the diagnostic was carried out with the ministry themselves so that they can do it for the other wings in the ministry, trying to help them to use rapid data and information which was coming in for policy making. So the ministry, for example, required much more capacity in data analytics and handling data analytics in real time, which is something that we were trying to do here. Now, the context, as we have seen in the presentation by our esteemed colleague from India, the context remains very same. Our real economic growth had turned negative for a time, and almost 73% of SMEs in Pakistan had to pause their operations as soon as the pandemic struck, and around 50% of them had reported layoffs. So the context was really difficult within which the ministry was operating. Now, of course, they knew the general context, but they wanted more sector-specific evidence on which of the SMEs should be sequenced to help first, who wanted first, where are those SMEs in terms of the geographical location. And we selected 12 main sectors based upon our dialogue with the ministry, based upon the priority, for example. Particularly, we went for firms who were participating in trade because we could understand how international supply chain disruptions must have impacted them. And in a span of 12 dialogues, which took place in about 4 months, we engaged with 614 participants and tried to sort of take their input to the ministry, which is now documented as part of a learning brief, and we'll be happy to share the learning brief as well, which has come out of this evidence brokering exercise. Some of the lessons which we have learned from this exercise, first was that reduced barriers to accessing and using evidence have to take place. We have to reduce the barriers, and some of the barriers are fairly obvious. They are documented in the evidence, but some of the barriers have to be diagnosed as the pandemic was unfolding. And public-private dialogue seemed like the easiest way to do because there was openness on part of the government to engage as well. In fact, pandemic was forcing the use of evidence here, as nobody had an autonomy on what evidence was best here or whose evidence was credible here. But in fact, there was an openness to hear everyone out. Second, improved capabilities to identify evidence needs was something which was much more desired, and voices of the marginalized were heard. In fact, many of the business communities who traditionally had not been heard in pre-COVID times, they were able to relay their voice. But there was certain element of capability that had to go in, certain level of openness at the civil service level, which was desired here. And that happened from the top as well, given that the cabinet directed that post-pandemic recovery should go beyond just the cherry-picked sectors and should also focus on those SMEs who have been left behind traditionally. And at the government's request, additional sessions were dedicated to, for example, the threats which were being faced by taking businesses online, by digital trade integration, given that for many of these businesses, they were coming online for the first time. So threats in the data protection realm, cybersecurity, safe trade, for these additional sessions had to be, or additional evidence had to be procured for the ministry. And the evidence brokering was such that we are now able to link the ministry with global think tanks who are specialists in this area of safe trade, such as ITC in Geneva or UNCTAD, where the ministry is able to now liaise themselves and source the evidence. And this is an example of partnerships for evidence use, as I suggested. So partnerships were not just with the foreign think tanks who could help, but locally as well, reaching out to think tanks within the chambers of commerce with whom MOUs were developed, and ministries now able to liaise with them on a more frequent basis. So this has now become a template, not just for COVID, but for disasters or sort of managing evidence during disasters in future as well. Fourth, we also looked into the incentives for evidence use, and we do understand that civil servants per se, of course, it's not in their TOR that they have to sort of use or consciously use evidence on a day-to-day basis. So here, of course, the public sector felt motivated to conduct or use deeper evidence for making smarter decisions for their stakeholders. But therein, of course, we made a case in another learning brief that we have used, that what kind of new incentives can be sort of built in or can be embedded at a process and system level to allow that motivation for civil servants to take place. Fifth was more effective translation of evidence. So while it's not that evidence was not pouring in from the private sector, the think tanks, but the fact that the evidence was not sort of being communicated in a language which the public sector can convert into policy, legislation, or regulation, that was curtailing the use of evidence. And therein, we've sort of set up a policy hub which takes the evidence from the academia and then converts it into knowledge products which are as per the government need or cabinet's need, even if these are like one-pager or two-pager policy briefs, which can then be filed in as summary to the cabinet. Sixth, we had to also identify additional enablers for evidence use. And for this purpose, of course, the work is ongoing, but one of the good examples is that following the Ministry of Commerce, the Ministry of Planning came forward, and now it's trying to use the same template of structured public-private dialogues and evidence use policy hub for a post-COVID industrial policy, for which, of course, the work has been initiated. Now, what more needs to be done? Three things. First is up-to-date evidence was found lacking even in the private space. So even if you have smart chambers of commerce or business associations, they need to invest in their own capabilities of generating evidence which is more suitable to public policy needs. Second, in our public-private dialogues, we found women-led firms often less willing to engage with the policymakers. This is something which needs to be more scientifically investigated, that whether it is about norms, traditions, or is it something more systemic. And third, evidence users and producers are currently still working in silos, at least in the trade sector, and just to say that public-private dialogue could bring them together is a very simplistic recommendation. We would need some smarter diagnostics to actually advise on how to bring them together in the coming days. In terms of a way forward, which is my last slide, we are trying to sort of also extend this template on evidence use to informal sector. Most of the evidence which the government is receiving is from the formal enterprise, formal SMEs, or formal exporters, for example. We now need to design on how to bridge the evidence gaps so that the informal segment, which may have increased during COVID times, their evidence can also reach the government table. So I'll just stop over here. Thank you for the opportunity.
Okay, thank you very much, and a little bit over time, so my camera's stopped working, but I'm still here. So thank you, Sir, for the presentation. Very interesting. I think I have heard you present it before, but it's very interesting insight to how you engage with policy. I haven't said to anyone, I keep forgetting, please put any questions in the chat or the Q&A. Most people use the chat rather than the Q&A because it's there, it's obvious, everyone can see it. And the chat is for this particular panel. If you stick on the right-hand side panel chat, so it's only people in this session can see it. Presenters, feel free to respond to questions in the chat because there may not be time at the end, and it's fine to have a dialogue going on there. And you'll see, actually, I posted the form, and I'll post it again now. The form to vote for the best panel, best presenter is up, and please do the votes about the awards, the prizes, in the closing ceremony later on today. Okay, so next presenter is Lanta Daniel. Lanta is with the Science, Technology, Innovation Policy Research. Sorry, I said that wrong. Science, Technology and Innovation Policy Research in Tanzania. And Lanta, over to you.
Unmute. Okay. Thank you, Howard. Well, I see we've remained with very little time. Okay.
So we've got time to run over. There's no session after this one until the closing plenary. So don't feel too pressured, but don't feel too relaxed either. Feel moderately pressured.
Okay. So how do I share my slide again?
Okay, so there's a little picture of a screen at the bottom, underneath the names with a cross through it. You click on that. That's the easy part. Then you'll get a panel at the top, and you click on Window, and then you should click on the window of your PowerPoint in it. So you need your PowerPoint open first before you start that process.
Okay. I get it. Yes. Can you now see the PowerPoint?
No, I'm not yet. But if you got on first go, you'd be the first person to do so.
It's not there yet?
No.
Oh, so maybe I'll just speak without the PowerPoint, so that will save time. And I'll share it later on.
Okay, that's fine.
Yes. So basically, this is a study comparing two countries in Eastern Africa, Uganda and Tanzania, on the fishery sector, the impact of COVID on the fishery sector. The two countries share Lake Victoria for fishery activities, and they're both similar in terms of economic activities that are going around there. The community, the culture, the share of fishery sector in the economy. But the difference between the two countries, one opted for a total lockdown and the other did not. So we wanted to compare and see the impact of COVID-19 to these two countries that use the different approach to fighting COVID-19. So it was a short study of 3 months. Basically, it was a qualitative kind of study comparing the two countries. A lot of data were from secondary data, and of course complemented with key informant interviews from different people. So going straight forward is we looked at this impact in these different nodes in the fishery sector value chain, means during production, during processing, marketing, and consumption. So I'll quickly go to what went on in production node, where people now go fishing. What's the difference? What happened in Tanzania and what happened in Uganda? In Tanzania, with no lockdown, so obviously everything remained about the same. Where in Uganda, so because of the lockdown, there were restrictions to businesses, and the only few essential ones, fishery included, was the one remaining open. So there was a flock of people, youth, from these other economic activity going to fishery. So also because of the sanitary measures, social distancing, despite a flock of fishermen now, but still they had to do social distancing. So it reduced a number of people go in a boat, a crew member going fishing, and then on top of that, there has to be a scheduling. Like everybody else had to go fishing. So if a fisherman used to go every day to the lake, now he had to wait 2 or 3 days before his turn. So that also had effect on the income. Also on operation costs, there was a change on the type now of fish that was consumed the most, because we have Nile perch that is mainly for export, and due to border closures now export could not take place. So those who were fishing in the species that are for export had to to change to locally consumed species, and that means buying new fishing gears and changing the way they operate. So that was an additional cost, and on top of that, post-harvest losses because of the curfews that were to be maintained. So at the end of the day, a lot of fish remained unsold that were supposed to be sold on that day. On the processing node, basically we have two kind of processing: the artisanal processing, where it's for local consumption, and industrial processing for export. So again, for Tanzania, artisanal processing for local consumption went on unchanged, but for industrial processing, since the markets were closed because of the flight cancellation, all that went down. But for Uganda, it was both for artisanal processing and industrial processing. The industries had to cut down people working on the industries. They had to provide shift for them, because now at a time only few workers could work there, and means they had to provide accommodation for them. They'll have to sleep, shift even in the night. So they had to accommodate them. So there was cost on utility bills and all those sort of things to just accommodate the fishes in the factories. And on a marketing node, again, for Tanzania, local marketing really didn't change much. For Uganda, because of lockdown, those restriction on time, cars could be seen on the road. So even if you've got your fish, but you need to take it somewhere to a customer or someone, you'll have to wait till a certain time, and there was still a limited time. So for that case, transport became expensive, and there was a need now of more storage, because now you can't sell all what you have on a day. So cost on storage also increased. And when you come to consumption, in both countries there was reduced consumption of fish. But the reason given by consumers in Tanzania was mainly reduced earning from the impact of COVID on these other business activities. So there was reduced earning, and for that reason they cut down fish. And for Uganda, there's reduced earning, but then fish were not readily available to the areas a bit far from the lake. So fish was not there. And then transportation limitation, which then brought about to costs in transportation. So all these really led to reduction in fish consumption. In terms of ICT, what the roles that ICT played. The really was not anything new that came out in terms of tools or platform for the fishery sector, how to sell or communication, but the traditional tools, the radio, the TVs, the mobile phone, were used more, and specifically in marketing. The social medias were used, the use increased, and of course the mobile phone for delivering services. That's the role that ICT played much. So just to sum it up, the picture that we got from this study is, yes, despite the lockdown and the no lockdown scenario in the two countries, there is still negative impact that went to this community, but they different magnitude. Where we obviously seen that where the lockdown was present, the impact was much more, and this got to a general conclusion that when we plan these policies, especially for COVID-19 and other emergencies, it's good to strike a balance between the health preventive measure, but also without forgetting the livelihood, the overall picture of the community. Because yes, we don't want people to die from COVID-19. So maybe we need the lockdowns, we need these other strict measures, but then we might be killing this community from other areas, maybe hunger, maybe less incomes. So the bigger message here is to strike a balance between the two interventions when dealing with these emergencies. Maybe smart lockdown would work, partial lockdown. Yes, and that's the end. Thank you.
Okay, Lanta, thank you very much. And actually, I quite like presentations without PowerPoints. It forces us to focus on what you're saying instead. So, and I found it very interesting. I do work quite a bit in Uganda, so I thought it was interesting. I do have a question, which I'll put into the chat rather than take time asking you now. But it's interesting that in sub-Saharan Africa in general, countries are focused much more on the social economic impact rather than just on the health side of it, whereas in developed countries, like the UK, I'm British, but I live in Germany, both UK and Germany have focused, the decision has been really driven by, let's reduce COVID, let's reduce number of infections, let's reduce number of deaths. Whereas in sub-Saharan Africa, where it was expected, the virus would have bigger effect health-wise than it has so far, thankfully. Despite some increases earlier this year, there's been more debate and more focus on, well, let's think about the economic consequences of going into lockdown. So I think that's an interesting contrast. Okay, so we do need to move on to the fourth and final speaker, which is Amany Sadeq from Egypt. She's an architect and going to be speaking about urban development. So Amany, over to you. You're still muted. Okay, looks better. We can't hear you if you're saying anything. Okay, that's the okay. I can see the PowerPoint, but not full screen. But I still can't hear you. You're not muted, so that's not the problem. There's some problem with the speaker. Okay, I think I can hear you now.
Hello.
Oh no,
yes. Actually, Amany, can you check that? Go to setting.
Where is that?
Yeah, the setting is below to the panel, and the next to the screen share button. Yeah, this one. And click on the first one, mic. So just select the another device. Second one. Apply.
Okay, still can't hear you.
Not working?
Well, I can't hear her.
Okay. Just go to again and to the previous setting.
I'm going to try this for my camera while we're doing this.
Yeah. Oh, it's not. No, we can't hear you.
Amany, can you try logging in and logging out and logging in again?
Yeah. Try to rejoin. Yeah.
I'm sorry, everyone, for the slight delay. If you have, let's while we're waiting for Amany to do that, maybe I'll ask questions. So, Reimeingam, in your presentation, you said most people don't migrate for reasons of employment, which surprised me a lot, to be honest. I would have thought that was a major motivation. I can see maybe marriage and school or something, including under 18s might be a reason. But if employment's not the major reason why people migrate, what is it? This is for Reimeingam, who made the first presentation, this question. Are you still there?
Yeah, I'm. Yeah, I'm there. I'm here.
Yeah.
Can you please come back once?
You said that the employment is not the reason most people migrate, which surprised me. What is the reason people migrate?
No, I was saying that the past data, 2011, 2001 data, previous data shows that the share of people, migrants for employment was hovering around 10%. Is that the context on that?
Yes, that one. Why?
Yes,
I'm very surprised it's
yeah,
only 10%. What are
yes,
the other reasons people
yeah.
migrate?
No, what I was saying was that for employment it was not very significant. It was around 10%. It was hovering around 10% of the entire total migrants reasons for migration for employment. So the other reasons are very various, like for education, for marriage, for because of natural calamities and so on and so forth. So yeah, if we see if we see by different reasons of migrations, then particularly for females, like for example, a majority, like around 67% of them are out migrated for marriage, like that. So what I was saying was, as a single reason for migrations, employment was. Of course, employment is one of the reasons for migrations, but it was hovering around 10%, which was not very significant in comparisons with other reasons.
No, okay, thank you. No, so the other reason I thought they might be. I'm surprised employment's so low. Okay, we have Amany back. Let's see how many we can hear you now, please. Not hearing you. Can you try the settings thing again that Azar suggested?
Yes. Please try again.
We can see you fine. Well, we could. We turn the camera off. We could see you fine, but we can't hear you.
Are you using
see
system mic, or are you using any headphone or something? Or is there something headphone?
How about the browser? Is the browser, would that make a difference, Azar? Are you using Chrome? Because Chrome is the preferred browser for Hopin. Well, you didn't have this problem before. So it's a new one. It's kept for the last day. Let me have a look. Something.
Yeah, there must be something issue with the device, maybe.
I'm not sure what we can do about this. I haven't seen the presentation before, so I can't help present. Okay, unfortunately, you only got in. For some reason, we also couldn't get you to join earlier, so we didn't do a pre-test. I mean, are you using Chrome? If you're not using Chrome and you have Chrome, you could log in and out using Chrome. Otherwise, I'm not sure what we can do. Well, okay, I'm going to suggest this, Amany. When none of us, I think, here are old enough to remember silent movies. I've seen them, I don't remember them. So I suggest you do a silent movie presentation in your PowerPoint. And I'm sorry, it's all I can suggest. So Lanta presented words and no pictures. I suggest you just present pictures. So maybe put up your PowerPoint and just take us through it. You say it. So you take us through at the right speed. We won't hear you, but we'll see it. Oh, she's gone. And we'll see it. And then we can just see the PowerPoint over the space of 5 minutes while you present it, and then we'll get to see it that way. So it'll be like a silent movie presentation of the PowerPoint. That's assuming you come back. You come back, good. Okay. Nope. We can see. We can see you speaking, but we can't hear what you're saying. And I know you can't see me, but so I was suggesting doing a silent movie presentation. We're trying to innovate formats all the time. So put up your PowerPoint and just go through it slowly. You can speak, we can't hear you, and we'll read the PowerPoint as you present it. Yes, and so it's like a silent movie. I think you made the effort to make the presentation. I think we should see it. So please share the PowerPoint again. That worked, and we'll go through it. I might give running commentary. There it is. It's not in full screen mode, but we can see it. Yep, now that's perfect. Only we could hear you. So, enhancing urban resilience in Egypt towards a place-based approach to managing the impacts of COVID-19 on Egyptian households. Some of you will know that I lived in Cairo for 10 years, so will know some of the context. Okay, this is quite long. We're not going to read all of this. But basically, it says, of course, there's been COVID-19 since 2019. Early interventions are most successful in trying to reduce virus spreads, like we saw in China, where you had very extreme lockdown. So the main objective of this research, look at the efficacy of policy responses in Egypt, looking at vulnerabilities in the urban health context, investigating the impacts in Egyptian households, and recommending a resilient place-based approach. Okay, next slide. Okay, so urban vulnerabilities, 40% of people in Egypt live in urban areas. 8.4 million people have gone into into home quarantine. There's an extreme problem in Egypt, as in many developing countries, of household crowding. So 8.3 million people, the population of Egypt is around 90 million, so around 10%, just under 10%, live. So that's 1.2 million households live in a single room. So that's just under 10% of households live in one room, so all people in one room. And only 6.2 million don't have any tap inside the house, so many lack access to clean water. Thank you. Next slide. Poverty, so people don't have access to economic security, basically. So around a third of Egyptians are poor by national poverty line, and around 6 million live in extreme poverty. There's a lack of access to online information, so internet penetration is just over half, around 60%, and only a small number use fixed line infrastructure. And in many countries, people rely on mobile phones rather than fixed line. And informal workers, informal sector, like in many countries, we heard this in India too, in the earlier presentation, the informal sector is very large, contributes 34% of GDP, but nearly 2/3 of the workforce are in the informal sector. Next slide. So government expenditure, government expenditure on health is very low. So it's just 1.5% of GDP compared to nearly 6% of global average. Out of pot expenditures on health are much larger in Egypt. It's 62.2. I'm not sure what the number is. Can't be percentage, but maybe percent of health expenditures. So out-of-pocket expenditures, percent of health expenditures is nearly 2/3 of all health expenditures are out of pocket. So people pay directly rather than having any health insurance or government-provided health services. Number of medical personnel per 1,000 is low. It's half. It's just under half. Just over half the WHO recommended number of doctors, and number of hospital beds again is around half the global average. So lack of extreme health vulnerabilities in this environment. Here's the timeline of measures that took place. So the first confirmed COVID case in Egypt were back in February 2020. Which was a foreigner. First confirmed cases of amongst Egyptians were in March of last year, And then it grew quickly. A couple of weeks later, they closed gyms, halted air travel, and dedicated hospitals towards COVID. And then later that month, a week later, night-term curfew, closing restaurants, and so on. That lasted a couple of months. General lifting restrictions, with a number of hospitals being dedicated. Then lifting all restrictions in August, and then again later this year, there was again closing of many things, weddings and using masks and so on. Okay, thank you. Next slide. Here's testing and tracing. So we see that we compare Egypt to other countries. You see that testing and tracing is virtually absent compared to other countries across the Arab region. So in UAE, Emirates, which is the smallest country, has the largest number of tests, and Egypt is at the bottom graph with virtually none. That's the left-hand graph, and on the right-hand graph, we see that vaccinations been driven mainly by the richer states in the Arab region. Egypt down towards the bottom. The war-affected states of Yemen, Sudan, and Syria and Libya do worse, but after that comes Egypt. And so, as of a date I can't see, but sometime during this year, less than 10%, only 7.4% of the population have actually been fully vaccinated. So vaccination rates remain very low. Next slide. Economic measures have taken place to counteract this. So obviously, tourism has been very badly hit, and so there's been a lot of economic responses to support the tourism sector, health sector, and irregular worker support. They've received some measures. There was a furlough scheme with anyone could apply to get a cash grant. They have a cash transfer program in Egypt, the Solidarity and Dignity program, for Karema, and that was expended to reach another 3.6 million families. But that's, as we saw earlier numbers, that's less than half of the poorest Egyptians. So while the cash transfer was extended, it really was inadequate, and the amount received, I forget the amount now, is £500 or something, which is not much money at all, 20 euros, was given out to anyone that applied, but it was a very small amount. Next slide. So here are the impacts. I would note that we think in many countries the reported cases are not reliable number, and Amany makes this point on the slide. So what we're looking at here is the death rate compared to excess deaths. So actually, particularly the right-hand graph makes this point very nicely. The blue line at the bottom is confirmed deaths from COVID, whereas the red line is actually excess deaths. So the deaths in that month compared to deaths usually occurring in that month. And there we see very clearly a lot of excess deaths. So as I mentioned, my family connection, my wife's Egyptian, and barely a day passed at some points where she didn't know someone who knew someone in their family who had died. So really the death rates have been extremely high. Next slide. So here again we have the excess mortality indicator, and this is done in a more sophisticated way, statistical adjustments using the US data excess mortality indicator, which is a percentage of additional deaths in a particular time period. And here we see the excess deaths peaking over 80% in June of last year, going back up to over 70% in May of this year. They've gone down again now, but we all know COVID is far from gone away. Thank you. Next slide. And here's the impacts looking across the different governorates across Egypt. So these are the provinces or regions. And this gives some idea of the spread of the infection. So we see that it's higher in Upper Egypt and Aswan, for example. I'm looking across. So actually, the more urban areas in Cairo and up towards the Delta, in Alexandria and Port Said, Suez, are all around the average actually a bit below average for the country at around 15%. But we see it peaking in Qunayr and Aswan up in the northern Luxor, all up in Upper Egypt, where we see much higher levels and reaching 60% in Aswan. So there's been an uneven distribution of the epidemic, and this Amany says this reflects the spread of the infections. I think also probably reflects the effectiveness of the policy response, the extent to which people are willing to implement social distancing. So next slide. So here we see vaccination. Indeed, this is like a converse of the previous graph, because the areas with lower vaccination rates of the bottom part, the south, is where these high incidence areas are, so on and so on. Whereas the north and the areas around Cairo is one of the dark red bits there, and the other dark reds in the Delta region, which is the more populated areas, the rest is desert, are the areas with the highest vaccination rates. Actually, just going back to social distancing, I was in Uganda last month, and there was a curfew on, and I was in Kampala to start with, the curfew was being enforced. I went to Mbale in the north of the country in the second week, and it was like there was no curfew. So I suspect the same as in Egypt. No, I was in Egypt in the summer. You don't see much adherence to social distancing measures, and once you get outside of Cairo, I think social distancing has been less effective, and that also helps explain this. And that's what, indeed, the last sentence in this slide is laxity in implementing social distancing measures. Next slide. And here's the impact in the sense of the excess mortality in the rural areas. So this is where the data are available. So you do see higher incidence, particularly actually along the north coast there, which is a bit interesting to try and explain that. I'd be interested to know more about that. And so it does mention Alexandria, Luxor, and Gulabea being high areas. Okay, next slide. Next slide, please, Emily. Now we move on to social economic impact. So here we look at the employment status, and we see particularly, so I wrote it down, that Azar mentioned that 73% of SMEs in Pakistan paused operations. My wife's been doing a survey actually in Egypt of the impact on the industrial sector of COVID, and gets similar numbers of the proportions of enterprises either stopping work or slowing down work. And so here we see in total over half enterprises, over half of people say they're working less hours. Around 20% are disemployment status change. So around a quarter became unemployed, and around 20% less working hours. And change in income in the bottom half of the slide. Oh, so I hadn't finished the bit there. Income increase is virtually nobody. That's unsurprising. Income decline is 3/4 basically across the whole population. So for most people, income has gone down, and around a quarter have the same income. Next slide. And here we have the reasons for income decline after the pandemic. So some is around a third because unemployed, some is because of reduced demand for whatever they're providing, because many people are self-employed, some because they've got a pay cut, some because their business was closed, and the largest though is containment measures. So the way in which lockdown implemented affected income. So nearly 2/3 of people say their income was adversely affected by lockdown. Next slide. And means of financial support. So how did they survive then? Well, around a half borrowed, just under a fifth or so, a bit less, relied on charitable contributions. And I can't read that next bit. But they're the main reasons, they're borrowing and getting gifts. And then if you look at the top slides, you see that around a quarter of households, or fifth to a quarter, said that insufficient income. They basically didn't have enough to live as a result of COVID-19. Next slide. So finally, conclusions. So we see clearly COVID-19 has really deeply affected Egyptian people because of chronic vulnerabilities. The health system, social economic system wasn't ready to withstand a shock like this. You had very weak social protection, weak health system. The government was late in taking measures. The government was, as in many other countries, the government was initially in denial about whether COVID was really going to be an issue in Egypt or not, and so they were late in halting air travel and so on. The public health and social measures were delayed and couldn't prevent the spread of COVID-19. Economic measures haven't been sufficient. They haven't reached sufficient people, haven't been large enough, and the vaccination has been very low. And there's an urgent need to think about policy responses to this and future shocks. I mean, what we've learned from this shock is we're ill prepared to withstand major shocks like this, and we need to think about the social protection systems. So the recommendation rates are to have a comprehensive combination of both containment, lockdown type policies to spread the virus. So strict banning of gatherings and public events, really have physical distancing measures in force in the way you have, for example, in the UK much more, or here in Germany. Have for example, mask wearing mandates in public indoor environments and public transport, markets and so on. Have information sharing around COVID, like, so you see here the COVID cases map in the UK, but UK actually was quite late on this. Early on in the pandemic, I have a colleague in Vietnam that was sending me the tracking tracing system in Vietnam, where they were naming the people who had it and how it had spread to the third level. This person gave it to this person gave it to this person to the third degree, and they were using tracking tracing to that extent. And actually, we have colleagues on the call from Gansu province where Lanzhou University is, and they had fewer than 20 cases come up last weekend. So everyone in the province, that's in Gansu province, there's over 20 million people, have had to be tested 3 times in the last week in order to contain the spread of the virus. And if you've been anywhere near someone's had it, you have to go into lockdown. So really extreme measures. And so these data collection methods really do help. But I would say you do need a strong state like you have in China, that you don't have to the same degree in Egypt to be able to enforce these measures. Okay, next slide. Spatial mapping, exactly. So now I'll come to the urban aspects of this. So use spatial mapping so you can see where it is, so you can see where the hotspots are, and so you can detect infections in communities and move on to actually targeting both targeting lockdown measures, targeting where you need to enforce social distancing and so on, but also prioritize the response, both the health response, prioritizing vaccination in low-income areas, where there is vaccination resistance. There is a lot of, my wife had a colleague who posted anti-vaccination stuff on Facebook, and a week later he was dead from COVID. So there's a lot of anti-vaccination sentiment still that needs to be overcome, but also targeting the social relief in these areas. We've seen the social relief is insufficient. And so this was one of my responses to Reimeingam presentation. We've seen the poorest states, Uttar Pradesh and Bihar, is where most of the migrants came from. So that's where they've gone back to. But these are the poorest states. So what social protection measures were put in place in those poorest states in India in order to receive those migrants? And so once you've got the infection rate down, then you can try and put in place a test and tracing policy. I think that's quite ambitious. Next slide. Okay, thank you, Amany, for the virtual presentation. I hope people didn't mind me stepping in to present it. I have found it a very interesting presentation. So we are open now to comments and questions, and there are some. There's a reminder to go and vote, but I have asked some questions. Let me. I did ask a question, Reimeingam. I asked. Lanta, I had a question for you, and anyone else please come in with questions either in the chat box or just say you want to join. Lanta, what interests me, because there was this extreme lockdown in Uganda, they were quite serious about it in the first lockdown particularly, and in May when the virus re-emerged. So did people, because fishing was one of the allowed industries, so you were in fishing, you could actually still keep working. Did people who weren't in fishing previously try and enter the profession? Because it was somewhere you could try and make a livelihood.
Yes, so that was what happened. Because these other businesses were closed, they had to earn the income, so they couldn't just stay home. So they joined the kind of activities that were still allowed to be doing, and fishery was one of them. So there was overcrowding on that kind of activity.
Thanks for getting a bit of an echo, but I did hear the answer clearly. That's very interesting. Actually, something hadn't occurred to me before until I heard your presentation. That's going to be one of the adverse implications. You're already saying because social distancing measures, people had to actually have fewer in a boat and go out fishing less times and everything. And then you've got additional entrance into the market. And so that becomes very difficult. And then you've got the additional problems you mentioned, like the curfew meant people couldn't actually sell the fish in time. And so you also got wastage and so on. So it's present in highlight very nicely in your presentation. You really need to think through the socioeconomic consequences of the lockdown. I had a question, Vaqar, are you still here? You're still here as Yoshika? I'm not seeing you. I think we lost him. I had a question for him about why he chose trade as the sector who's going to work in. Okay, we're quite a bit over time, so I think we have to stop. Actually, I'm meant to be in another meeting now, so I do have to stop. So thank you, everyone. I think it was a very interesting session. I'm sorry we ran into a lot of problems with hopping, but that's been the norm rather than the exception. Our apologies for that. Do please all come to the final session today, the closing session. I think there's nothing now between now and then, but do go and vote. Any colleagues and friends you know that were at the workshop at the conference over the last 10 days, please do tell them to vote as well. So thank everyone. I'll see you all at the closing ceremony in just over an hour. Bye bye.
Thank you.